Hello everyone. So in this video, we are going to discuss about the accelerated rehab protocol for ACL reconstruction. Now this accelerated rehab protocol is specially designed for athletic population, and that is why I have taken reference from the Melbourne ACL Guide 2.0, as well as I have taken reference from recent articles for the exercises which I am going to show you all in this particular protocol. Now this protocol can be applied generally for any athletic population, but you have to be specific according to the person's sports specific requirements. So that we will anyways discuss when that phase rehabilitation comes up. So this protocol I am going to explain in this 6 sub phases. The first one is pre-operative sub phase. Then second is recovery from surgery, which is immediately after hospital or immediately after surgery. The third one is strength and neuromuscular control. Fourth stage is running, agility and landings. Fifth one is return to sports, and sixth one is prevention of re-injury. Now, almost all these 6 phases are very important when you are rehabilitating anybody from the ACL reconstruction. Let's discuss about the pre-operative phase first, because this is a very crucial phase. In this, we educate our patient more and more, and we make sure that patient is understanding the importance of physiotherapy and how physiotherapy is going to help after the surgery. So here the goals are diminishing the inflammation, swelling and pain, restoring normal range of motion, especially knee extension, because extension leg is very commonly found in this kind of surgery, post-surgery situations. Restore voluntary muscle contraction, patient education to prepare for surgery. And for that, we are also going to apply like how to, we are going to teach patient how to apply brace, knee brace or sleeves to reduce pain, then weight bearing, how to do it, whether how to use assistive device, not to use that, everything we are going to educate in this particular phase. Patient education about post-op rehab program and select appropriate surgical date. Normally, we decide that at least 25 to 40 days are there for pre-operative rehab phase from the day of surgery, because so that we can just easily strengthen the muscles, and after that we can easily recover the muscles after surgery as well. So that is why appropriate date of surgery has to be decided properly before only. So what exercise exactly we will give in this pre-op phase? So we are going to give ankle pumps, passive knee extension to 0 degrees, because as we mentioned in goals that complete extension is very much important. Passive knee flexion till tolerance, straight leg raises for increasing strength in hip flexors as well as knee extensors, mini squats, lunges, step ups. Now this all exercises are helping us for close kinematic chain exercises, as well as improving the proprioceptors or maintaining the proprioceptors in that particular area, so that better rehabilitation will be there post surgery. Then straight leg raise, then electrical muscle stimulation to quadriceps during voluntary quadricep exercise, which is for 4 to 6 hours. Now this is something new maybe for you all, which we also call it as functional electric stimulation. So this exercise is mainly given for improving quadricep muscle strength and reduce pain while doing exercises. This can be done 4 to 6 hours maximum for athletic population, and cryotherapy again for reducing pain, swelling after the exercises. Now immediate post-operative phase, which is the second phase, which is exactly after the surgery during the hospital stay. And in this phase, goals of physiotherapists are to restore full passive knee extension, diminishing joint swelling and pain, restoring patellar mobility, re-establishing quadriceps control, gradually improving knee flexion, and restoring independent ambulation. So these are our goals. So post-op day 1, this exercises can be given, which is application of brace, post-operative brace applied to knee locked in full extension during ambulation. Weight bearing is done as tolerated and suggested by the surgery performed doctors. And we can use crutches, we can use cane, we can use walker, whichever is comfortable for the patient, but most advisable we use frames. Okay, exercises are given along with that are ankle pumps, which we already have taught patient in the pre-op phase. Then overpressure into full passive knee extension. This is again very much important to reduce chances of extension leg. Active and passive knee flexion, we have to achieve 90-degree of flexion by day 5. SLR, which is straight leg raise, quadriceps isometric setting. In this, we are giving isometrics for quadriceps, not only one particular range, but different range, multiple angle isometrics, so that we can improve the strength in a better way. Hamstring stretches, so that we can achieve complete knee extension, mini squats, weight shifts, and CPM as needed 0 to 50. This is about day 1. From From day 2 to day 3, we are again continuing application of the brace, making sure that knee extension is locked at 0 degree. Weight bearing is done with the help of assisted device. It can be crutches, it can be frame, walker, anything as tolerated. Exercises, we are giving multi-angle isometrics for knee extension at 90 and 60. Patellar mobilization, again, patellar mobilization is very important. You must be knowing that when you are performing knee extension, patella glides upward as well as medial. And when we are doing flexion, it glides downward and laterally. So gliding of patella can help us improving knee range of motion. That is why it is given initial stage itself. Ankle pumps, SLR, standing hamstring curls, which is like weight bearing on the normal side, and affected limb has to be flexed against gravity so that we can also work on the hamstring muscle strength. And CPM is now increased up till 90 degrees range of motion for the patient. Post-op day 4 to 7 exercises, we are continuing all the exercises, but now we are removing the brace and performing range of motion exercises 4 to 6 times per day. Knee flexion, we are trying to achieve up till 90, which already we told that by day 5 we have to achieve it, and 100 by day 7. And proprioceptive and balance activities are initiated. Now these activities are initiated as tolerated for this particular phase. We are starting with patient has to first start standing on the limb without using brace. Then slowly we initiate walking pattern. Slowly we initiate weight bearing completely on that particular side. So this way we can initiate for the proprioceptive as well as balance activities by the end of day 7. Early rehabilitation phase, which is phase 3, which is of week 2 to week 4. But there are certain criteria to enter this phase that we will see. First criteria is quadricep control. What does it mean? So it means that patient should be actively able to extend the knee joint without any external support of brace. So that is there, then we can definitely directly jump into this phase. Second is full passive knee extension, which is like passively knee should go 0 degree extension or full extension, just like how the normal side is going. Passive range of motion of 0 to 90 degree of flexion for that particular affected knee joint. Good patellar mobility, minimal joint effusion, and independent ambulation, which is like without using any assistive device, patient is able to walk. Then only we will enter the patient in this particular phase. Here the goals are to maintain full passive knee extension, gradually increase knee flexion, diminishing swelling and pain, muscle training, restoring proprioception, and patellar mobility. Exercise for the same, we will be giving self range of motion stretching, like patient has to, like how example, for example, in prone knee bending, we can ask patient to pull the knee with the help of bed sheet or bends or anything. Then muscle stimulation to quadricep with exercise, like how I explained for the FES, functional electrical stimulation, while performing activities can help us to achieve more activation of the muscles and also strengthening of the muscle. Half squats, now we are progressing from mini squat to the half squat. Front and side lunges, again for improving range of motion, because already we have achieved 90-degree range of motion before entering this phase, so we can easily perform these lunges. Then bicycling, which again helps us to improve control over hamstring quadricep muscles, and then over pressure into extension is continued. Well leg exercise, which is like whichever leg is not affected, that leg exercises also has to be continued for maintaining strength or improving strength. And progressive resisted extension program, which is starting with 1 pound and progress to the 1 pound per week. Like we have to increase 1 pound weight every week. So that can be progressive resisted exercise for extensors. Especially week 3, we are going to work on getting passive range of motion of 0 to 115. Normal range of motion, remember that for knee flexion is around 125 to 135. By week 3, we have to achieve at least 115. Pool walking can be initiated now. Hydrotherapy is a wonderful exercise in initial stage of any athletic recovery. Why? Because weight bearing is sufficient, as well as we can work on the, like with the help of buoyancy, with the help of hydrostatic pressure, we can work on the strengthening and control of the muscles as well. Then eccentric quadricep exercise. Now eccentric exercise of any muscle helps us to improve more strength. So that is why we perform this. So what is the example of this exercise? Normally when you do extension of the knee joint, after that when you are bringing it down, slowly when you bring it down, so what is happening, that you are maintaining the eccentric load over the quadricep, and that really helps for improving strength. Lateral lunges, lateral step ups, and stair stepper machine. If stair stepper machine is not available, we can just simply teach patient organize patient to perform stair climbing on the normal stairs which are available at your clinic or home or wherever. Phase 4 to phase 10. Next phase, which is phase 4 actually, because pre-operative phase, if we consider, this is going to be phase 4. This is a controlled ambulation phase. In this, timing which we take is week 4 to week 10, and criteria to enter this phase are active range of motion of knee joint 0 to 115, quadriceps strength greater than 60 percentage of contralateral side. Now this is very easily found out, like how we can check is for normal side we will check the strength of the patient, and then affected side we will check the strength of the patient, the same muscle, and we will find out if it is more than 60%, we can enter the patient in this phase. Minimal to no joint effusion, no joint line or patellofemoral pain. Now the pain is completely subsided, and this is the best time to enter this phase for the athlete. Here the goals are passive full knee range of motion, which is at least we have to achieve 125 to 130, improving lower limb strength, enhancing balance and neuromuscular control, and improving muscular endurance. Till now we were working on the muscle strength more. Now we are also going to focus on the muscle endurance. So here the exercises what we are going to give is progressing to the isometric strengthening program, which is like multiple angle isometrics we already have initiated. We were doing in 1690. Now we have to do it in further more range of motion as well. Leg press is introduced over here. We can do the leg press machine activities, lateral step overs, front step downs, Biodex stability system. Now what is this Biodex? So Biodex is a machine which uses isokinetic activation of the muscle, which requires a particular set of machine. If it is not available, still we can continue with the isotonic activities, doesn't matter much. Proprioceptive drills. Now we have to start working on the drills for the agility as well as proprioceptive activation. We have to start working on single limb weight bearing as well as jumping activities for more and more proprioceptors activation. Even we can use Bosu ball or trampoline for more proprioceptive activation. Then pool program. Now this time already we have initiated walking in the pool. Now this time we are talking about backward running inside the pool. That again helps us for initiating like pre-stretch over the hamstring muscle, as well as it also performs the strengthening for the quadriceps, hamstring, calf muscle all together. And inside pool it is going to add some resistance with the hydrostatic pressure. Also buoyancy is going to help a little bit. So this is the best way to start this backward running activities. This is what I was talking about, Biodex equipment for isokinetic functioning of the muscle. By week 6, we have to start with the pull forward running and agility drills. Agility drills, we know that it is like how we use T-test or shuttle test for like different direction movement. Immediately they have to change the direction and perform the movement. So these drills are initiated. We can initiate with like simple Z drills, or we can just start with the alternate changing direction till the 100 meters route, or this way we can improve the agility of that particular person. Balance on tilt boards can be started. Again, we can use Bosu ball or trampoline as well. Progressing to the balance board throws, which is like the person has to balance themselves on the balance board, and along with that, they have to do the throwing activities. That again helps us for maintaining more balance, improving more balance, as well as improving proprioceptive functioning. By week 8, we start with plyometric leg press. Now, what is this plyometric leg press? So you can see over here that plyometric leg press means we are pushing the machine away or body away and then just trying to come back. So it is like a jumping activity with the machine of leg press. The next one is perturbation training. The next thing is isokinetic exercises continued, and bicycle and endurance activities are continued. This is a kind of agility training that we can do for the person 10 meters or 10 yards between cones. And as you can see, the continuous changing of direction is present. This is again the leg press with using plyometric kind of variation. This is perturbation training. What we are doing is patient has to change the surfaces, try to weight bear on the affected side and maintain the balance. And this really helps for activation of the proprioceptors and strengthening of the muscles and also maintaining balance. Now this is the next phase, phase 5, which is sports recovery or back to the sports activity kind of phase. In this phase, if you want to enter, we require active full range of motion, quadriceps strength more than 80% compared to the contralateral side, and satisfactory clinical examination, which means no signs of swelling, inflammation, nothing is present, no pain is present, nothing is present, and also hop test 80% of contralateral side. Now the question comes, what is this hop test? So hop test is something in which person has to jump from the affected limb to the further area, like how much distance they can cover from by jumping on the affected limb to landing on the affected limb. That is what is measured in this hop test, which is performed for both normal as well as affected side, and we try to find out whether it is more than 80% of the normal side, then we can enter this particular phase. Here the goals are normalizing the lower extremity strength, enhancing muscular power and endurance, improving neuromuscular control, and perform selected sports specific drills. Now sports specific drills can be different for a football player, for a hockey player, for a rugby player, for a volleyball player, or for a basketball player. So that is why I have mentioned sports specific drills can be initiated from this particular phase. And the last phase is like recovery into the sports area as well as preventing from the further injuries, and that phase is going to last from week 16 to 22. Here how can we enter this phase? So full range of motion is already available, normal joint proprioception is there, functional hop test more than 85% on the contralateral side. And here is the example of your hop test, as I was mentioning, that jumping from the affected limb and covering as much distance as possible and landing also on the same affected limb, and that we are going to repeat for both affected as well as unaffected limbs. Here the goals are gradual return to full unrestricted sports without any injuries or worries, achieving maximal strength and endurance. And here we are continuing all the exercises what we were previously doing, but with more concentration, focusing on the strength, neuromuscular control, plyometric drills, running and agility program, and sports specific training. I really hope this video was very helpful for you all to understand the rehab protocol of ACL reconstruction, especially in accelerated way. If you have any doubts or you want to ask any questions specific to particular one condition, you can let me know in the comment section. And apart from this, if you want to watch other condition related videos or you want to watch about the differential diagnosis part, you can always come back and watch these videos on my channel. Playlists are already available and also link will be provided in the description.